There we go.
All right, I'll be right back, Katie.
Go for it.
Okay, I went to get my phone so I can have a stopwatch. So you don't have to buzz me. You're on mute, Katie.
Hi all, sorry about that. One of our panelists is about to call in. There are some technical difficulties on the back end, but she'll be here momentarily and then we'll get started.
So there's no reason we can't say hi, Juan, and hi, Jordan, right?
Hello.
Thanks for joining, guys.
Thank you.
And we're also live on our YouTube channel, so we'll have participants that way.
Right. That's what I was going to say is Katie is recording and streaming. So we have multiple audiences when we do these. And we're hoping that we get enough good feedback that people will get the word out, that we can get some more participation as we go.
Cool.
They may have a lot more participation when I'm not on the panel.
Yara, can you hear us?
I can. Hi.
Awesome. Okay, great. We'll go ahead and get started. Thanks everybody for your patience. Technical difficulties happen. We make it work. Well, welcome to our third webinar Wednesday. This is a series that we're running through the rest of the summer for the Health Management and Informatics Department. Today's subject, we're doing a deep dive into our Health Services Administration, not just what our program entails, but what the industry itself covers. Talking about everything that you're going to experience being in a hospital, working as an administrator, and what that means in the US and across the world. Our two panelists today, thank you so much for being here. We do have Shannon Elswick. He's introduced himself slightly, but they will go deeper into their backgrounds as they go over their portions. And then we also have Yara. She was going to be here via video, technical difficulties, but we will hear her sweet voice. And I promise that she looks exactly like the picture that we've got up on the slide for you. And of course, I will be your moderator today. My name is Katie Terry, and I'm one of the program coordinators for our Health Services Administration, our Master of Health Administration, our Executive Masters of Health Administration, and our Marketing and Communications. All right, so to get started, just a brief overview. Most of our audience is already familiar, at least, with health administration. So just a brief run-of-the-mill, it's the business side of healthcare, right? It's working with both the clinicians and the patients and trying to make sure that the delivery of healthcare is there. It's a culmination of the two, working together as a team in our healthcare system, working on skills like critical thinking, communication, healthcare information analysis, leadership. So it'll prepare our future healthcare leaders and managers in running efficient healthcare organizations and impacting community health outcomes. And with that brief overview, I'm going to go ahead and toss it over to Ms. Yara Ossie.
Hi, everyone. And Katie, just so I'm sure everyone can see my slides as I'm talking. Is that right?
Correct.
Okay, so I really apologize, everyone. The password that worked on the phone is not working on my video, so I might join like 5 minutes before the end. But anyway, my name is Dr. Yara Ossie. I am proud to be a two-time UCF alumna. I received my master's in 2007 and my PhD in 2015. I've been a lecturer, or I've been teaching in the department for 7 years this coming fall, which is hard to believe. My research is mostly in global health and development, but I've also worked in domestic health care at accountable care organizations. And I've worked with several NGOs like Amnesty International, the Arab Center, DC. I love research and presenting my research. So if research is something you're interested in, this is absolutely a major where there is a lot for you to look at. I'll be pursuing a Fulbright this coming year, assuming we can travel. And I'm also writing a book about war and conflict and public health. So I'm a bit all over the place, but I have taught and developed the UCF HSA Cornerstone course, which all students who enter our major are required to participate in. So I have met at this point thousands of students entering our program, and I'm also the faculty advisor for the HSASA student group, which is our Health Services Administration Student Association. So I have talked to so many students over my 7 years in the department, and I hope I have gotten a good sense by now of what they're looking for. So I will first start by talking a little bit about what is health. This is a really basic question, but I think it's much more complex than we assume. So, I mean, health is not just medicine, right? Health is not just a hospital. Health is a personal state of well-being. And according to the WHO, the World Health Organization, it's not just our physical health. It's not just are you sick or not, but it's physical, mental, and social well-being. So it's not merely the absence of disease, but it's a positive state. So the relationship between health, our personal health, and a health care system, which differs depending on your state, depending on your culture, depending on so many factors, there's so much room there for health administration of all types at all levels. So something that I might cover in one of the first weeks of my Cornerstone course, or one of the other courses I teach, which is the Civics and Healthcare class, is really what are the determinants of health? And I think that I like to teach this at the very beginning of the semester because it gets students thinking about what is it about health and health administration that interests me specifically. So when we talk about determinants of health, obviously I think many of us understand the genetic determinants. Maybe you're predisposed to a certain type of cancer or type 2 diabetes. That's just in your genes. We can't change that. That is one aspect of health, of course. But then there's our physical environment. Where do you live? Do you live by a factory that's not disposing of waste efficiently? Where you live, are there parks, your social environment? Are there sidewalks where you can take walks, where you can run? Are you close to grocery stores that sell fresh fruits and vegetables? And of course, our health behaviors. Do you smoke? Do you eat a healthy diet? Do you choose to exercise? So all of these different factors determine our personal health and then determine what our health system looks like. We build our health systems around these determinants. So when you're thinking about getting into health administration, you can think about the multifaceted dimensions of health. And there is a role for health administrators at each of these steps. So if you're interested in lifestyle, if you're interested in the social environment, or if you're interested more in the medical side, because we do get a lot of students who come from nursing or who come from preclinical programs, they want to stay in health, but they want to work more behind the scenes, or they want to work in policy. And health administration is really where all that happens. So my next slide, what are the top health topics of today? And I wanted to bring this up because when students come to my classes, my very first question to them is really, what is it about health that drew you in? There's got to be something that interests you, or you wouldn't have chosen this major. And I think for many students, especially in their first few years before they know much about the major itself, they say, I want to help people. I know so-and-so worked in healthcare, and so I want to work in healthcare too. But the more we learn about the topic, I think students really find their niche and are really able to orient their careers toward that. So these are just some of the topics that I'm talking about in my courses. Obviously, the top health and economic and political topic right now is COVID. But even just looking within COVID-19 and infectious disease, there's so many areas here. There's the vaccination, there's prevention, there's public health. There is, the public-facing aspect, public relations, communications, health promotion. So I know a lot of students are getting interested in this right now. One interesting thing from the last decade or so is the increase in partnerships and collaborations and mergers between top players in the industry. So you don't have to be too entrenched in the healthcare system. Maybe you've heard of the CBS-Aetna merger from last year. That was a huge deal within healthcare. It will totally revolutionize how healthcare is delivered. Or, Amazon is making different forays into healthcare and pharmaceuticals. There's a lot happening there. Obviously, health information technology, which is a huge emphasis in our program. Just going back to COVID, what are we seeing today? As a result is an increase in telehealth. I've gotten emails from every single one of my providers that now we offer telehealth, from pediatricians on up. So this is a trend that's being expedited by something that's happening that nobody 6 months ago could have foreseen. And now telehealth is probably the top health information technology in the world. We're trying it everywhere. There's so much potential there. The opioid epidemic is kind of taken a backseat to COVID in terms of the news, but many of our personal lives have been touched by the opioid epidemic, or we've heard stories. We have some excellent faculty that work on this topic within our department. So there's, in terms of the public health aspect or research, there's so much happening with that. If you're more interested in legislation or the economic aspects, there's the future of healthcare reform and the Affordable Care Act. It is the law of the land today, but as we've seen throughout the past century, healthcare laws change, they're added, they're removed, depending on who's in office, depending on the political situation, how the country is doing and other aspects. So, we might have forgotten about the debates of the Affordable Care Act from a few years ago, but they are re-emerging every now and then. And I think COVID has re-emphasized the importance of talking about our healthcare system to people. How we get pharmaceuticals and how we understand pharmaceuticals are changing. The industry, things are happening differently within the industry. This has really interested a lot of my students. Patient knowledge, nobody goes to the doctor now without having gone to WebMD or Googled what are my symptoms. You go to the doctor now, you're much more educated than the average patient 20, 25 years ago. How does the healthcare industry respond to that? How is consumer-driven care changing our healthcare system? And then, of course, there's big data and algorithms. And we also have some great faculty working on this topic within our major. So covering really the gamut of the U.S. healthcare system, there is something for everyone. If you're interested in technology, if you're interested in politics, if you're interested in the pure clinical side. So even if you're just skimming the news today, the health section, I think there's so much potential for, a new generation of health administrators. And that's why I think this major is so important. So to my next slide, what makes up a healthcare system? I think a lot of our students and a lot of people considering the program, assume that most people will work in a hospital, right? I'll go to Advent Health, I'll go to Orlando Health, I'll find a job there. But there's so much more potential for healthcare administrators and healthcare policy people. Obviously, there's healthcare facilities, and that's what we recognize as a geographical face of health, the clinic that you go to, whether it's CentraCare or whether it's, the huge Winnie Palmer Hospital downtown. Telehealth is changing our relationship with facilities, so that's really interesting. Do we need to go to a physical structure every time we need to have a healthcare need met? That's a question that a lot of people are asking. Some people really want to, some people don't. Our healthcare workforce, this is another topic that we talk about a lot, especially in the U.S. American healthcare course. Our nurses, our doctors, but also increasingly our physician assistants, our nurse practitioners. We are incorporating different care models and workforce models because we are suffering from shortages of nurses and doctors in this country. So how do we manage that? Do we need everyone to have an MD? This is, kind of some of the debates that we talk about in our courses. Obviously, the suppliers of medical products. One of the huge things that's been in the news lately is, the people manufacturing the swabs for the coronavirus tests. Something so basic, you think, and yet now this is one of the top priorities in the world is manufacturing some of this medical equipment, manufacturing ventilators and other kinds of treatments for COVID and other ailments. And then, of course, the healthcare financing system. We have our insurance companies, we have, the government financing. And talking about government, there's the interactions between government and entities at all these levels, from private and public clinics and facilities to research institutes to lobbying organizations to, scholarly organizations like the American Public Health Association. All of these different levels are interacting together. And I always find that students get really excited when they kind of take their mind out of that hospital box and realize I can really work anywhere that interests me. I don't have to just kind of assume that I'll be sitting behind a computer in a hospital. You can work at a startup. You can work at a health insurance company. Those jobs are completely different. Those industries are completely different. So one thing I wanted to touch on in the next slide is, I know a couple of our faculty, including our program director, Dr. Mark Bush, one of his favorite questions to ask students the first week of classes is, what do you want to be? And so many students will respond, they want to be a hospital CEO, right? And not every student wants that, but I do think that most of our students that we see are fairly ambitious, and they want to rise in the ranks. They want to build a career in this field. They don't want to just have a job. So I always like to do assignments that kind of show them how what they're learning in the major and how what we're talking about is expressed in the real world of these high-level positions, because they can seem kind of abstract. And I know Shannon will talk a lot more about the nitty-gritty of this, having lived it. But I always like to show them, so this is a screenshot that I took from a hospital CEO position, and the actual hospital doesn't quite matter. But I just wanted to point out some key words, and that will kind of give you the sense of the knowledge and expertise that we train in our graduates and that health administrators at all levels should have, whether you're a CEO or not. So the first word, policies, making these hard decisions. We teach our students, we really emphasize critical thinking and not just memorization, because building policy, you really need to have that creative, innovative spirit. What's going to work? Who are my stakeholders? How do I pay for it? Policy is extremely complicated. That's a job in and of itself. The next one, leadership. It's hard to describe good leadership, but I think we all know when it's not good. I think we've probably all worked under that experience. So just like anything else, leadership is a skill, and it's a skill that needs to be taught and honed, and you make mistakes, and there's things to learn and practices to try. And we address all of that with our students. We don't just wait till they're out in the field and then they realize, oh, I need to develop a leadership style. Accreditation and compliance is something that all hospitals and facilities have to go to, and administrators have to be aware of the different accreditation for their city, for their state, for their industry, for the different departments in their facility, if they have a large or small facility. You have to be concerned with the recruiting and retention, not just of your clinical staff, but of your fellow administrators and executives, all the way down. How do you build an attractive facility? And keep in mind, this is one person's position. Keyword here, profitable, right? We have to remember healthcare is a business. And if you're running a hospital, it can't just be do everything to help everyone immediately. We have to pay for these things. How will we get the money? How do we make our facility profitable so we can buy that new MRI system, or so that we can build that new facility in a rural, underserved area? You have to manage costs. You have to deal with data with your other executives, like a chief financial officer or a chief nursing officer. The C-suite has grown exponentially from just a CEO or a CFO. There's so many executive positions in hospital now. You may have a chief diversity officer, a chief information officer. You have to manage all of the stakeholders and all their priorities, because sometimes they will be in synergy, but oftentimes what your leadership team needs will differ, and you have to decide what to prioritize. And then, of course, developing positive relations with the community is extremely important, and that is a skill that can take 24/7 of a CEO's job if they let it. So I just wanted to point this out to our audience, just to see just really how diverse the high-level jobs in healthcare are. And I think that this really breaks it down for people at the beginning of their career of, okay, if I want to get to this stage in 10, 15, 20 years, what am I looking for as I develop as a student, and then as someone in my early career, and then hopefully as someone who is pursuing these types of high-level jobs? I find that doing kind of this retrospective look is really inspiring and motivating to students, and helps them think, okay, what do I need to work on? What am I weak on? How do I network to learn these skills and get these kind of entry-level jobs? So I think this is always a good exercise for anyone who's watching. Even if you're relatively interested in this, if you just go to one of the job sites like Indeed or something, Indeed.com, and search for, hospital vice president or public health research, whatever your interest is, and look at what some of the jobs are asking for. Do they want a master's degree? If that's not something you're interested in, do they require a lot of travel? Is it more writing? Is it more, being out in the community? So take a look and see what maybe your quote unquote dream job requires. And that will help you kind of develop and build your career around that. And then my last slide will address what is by far the number one question that I get from students and people interested in the major and their parents and basically everybody is, where can I work? So as I addressed, 30% of our graduates will end up in hospitals, especially at the beginning of their career, because that is a nice kind of funnel system to get them into the healthcare industry. There's a lot of entry-level jobs within hospital systems, but then most students that I have followed their careers over time, they move on from the big hospital setting to something smaller. So while many will start in a hospital or will stay in a hospital, I want people to be really aware of the diversity of the field and the places you can work. And I won't read this list bullet by bullet, but I just want to show people that there's so much potential in this field. A lot of students ask me, what's the difference between this and just getting a business degree? And I think if you really want to work in somewhere like a nursing home, long-term care facility, we have a ton of those in Florida. Outpatient care, we are really shifting away from the hospital model because hospitals are so expensive. Outpatient care is booming and will for the next several decades. Mental health, rehab, consulting, biotech and pharmaceuticals. There's so many areas in health administration. So I really hope that kind of skimming this and taking a look at what the field has to offer will get some gears turning. If you're interested in the field, if you're just interested in health and you don't really know where you want to go, maybe you want to be a doctor, maybe not. I think there's a lot of opportunity and potential here. So I hope that helps kind of pique your interest before we go into what Shannon will discuss with us, which I know is much more granular and on the ground. So thank you so much. And again, I apologize. I could not be there on video.
Thank you, Yara. Sorry about that, everyone. We had to click to get the bullets. I'm going to go ahead and pass it over to Shannon. He's going to go a little bit deeper and talk to us more about like the upper level, moving in to kind of bouncing off of everything Yara went over.
Yeah, and I'd like to add my personal thanks to Dr. Ossie for her presentation. It's very interesting that you have kind of both sides of the coin as it relates to our faculty here. You have someone who's very highly trained on the academic side and is a marvelous researcher. And then you got a guy that just worked for 40 years and, couldn't find anything else to do and managed to land a job and has been teaching for the last 5 years. So Katie, if you'll advance the slide, my career track is not typical, but I think it does help as you're looking at, what does it take to get there? Well, my first job in the hospital actually was selling newspapers and cleaning medical office buildings. But my first full-time job was as an orderly. And you can just see by the slide that, I went in the Navy for 6 years. I became a clinic manager and then a medical records manager and then a business manager and then a couple of director level positions. Had a chance to be an acting CFO, then a vice president in the hospital, then the CEO of a couple of hospitals, then the senior vice president of a group of hospitals for a large health system. And now I teach. But the interesting thing for me is that all of those different experiences, just like we just heard, prepared me for leadership roles at the next most progressive level. My education came because I needed it to go to the next advancement opportunity. It was not that the education itself taught me what I needed to know to become a senior executive. So if we can go to the next slide, please, Katie. I just wanted to put this in there, and I definitely appreciate the setup, for this part of the presentation. But why healthcare? And when you just look at the raw numbers, no other occupational group that exists in the country today is projected to grow more than healthcare occupations. So almost 2 million jobs over that 10-year period, which by far exceeds any other group. In addition, when you conglomerate all the healthcare jobs, the average medium annual wage for all healthcare is significantly more than just the average median wage in all jobs. Now, for some, that would make a lot of sense because we do have some higher level positions that other industries don't have. But the thing that I thought was most important for this conversation is if you look at medical and health services managers, and that can be anyone from, like I was the manager of medical records at a teaching hospital, and I was the CEO of a hospital and the senior vice president in a health system. All of those were healthcare management jobs. But medical health services managers are projected to grow at a rate more than the occupations itself. So almost 20% over 10 years growth in these particular jobs. So that's why healthcare is important. But I also thought that from my standpoint, it's what does it take to get there? And so if you go to the next slide, please, Katie, we'll look at different levels along the way. There are different, I would call them skill sets that need to be developed. First of all, when students ask me what it takes to become the CEO of a hospital, they're somewhat disappointed with my answer, because my answer is you get a job in the industry you love, you go to work the very first day and you work hard, you try to learn more about that particular job or that industry, you go back the next day, use what you learned the day before, work hard again, learn more, and then you just do that day after day after day for 40 years and you'll be successful. Now, people think that sounds kind of flip, but it's actually the truth. Now, to leverage opportunities as you go along, there are some particular things. So in our program, HSA and MHA are emerging into the market, many of them into an early supervisory position. Now they may need to work for a few years in a certain department to achieve that responsibility, but we call all of those people early careerists. When you're an early careerist, and I'm speaking to people who may be graduating from either program in the next year or so, there's some things that are going to be most important. When I talk about 360, I'm talking about managing yourself. So we talk about 360 evaluations where the leader is evaluated not just by the boss, but also by their peers and their subordinates. I advocate that when you start, even before you have a long list of subordinates, that you practice the skills as if you were being evaluated by everyone, by the people that report to you, by the people you work with, and by the boss and the boss's boss, et cetera. As you think of that, it keeps you balanced, because if you only manage up in the organization, you're going to fail to lead and motivate the team around you. Job competence, I can't stress enough. Whatever your job is, you have to know it. You have to be, if you're not the most knowledgeable or among the most knowledgeable about that particular job or operation, it's going to be very difficult to achieve the kind of loyalty from your staff that you need to have. So as we look at what does it take to do all that? Well, through all this, work ethic is going to be important. At the peak of my career, it was not atypical at all for me to be putting in 55 hours a week. When my children were young, I would come home at a normal hour, get them through dinner, help them with homework, get everybody put to bed, and then I'd turn around and go back to the hospital and work through the night, come home in the morning. But those are the kinds of things that it took for me to be able to progress. I'll talk a little bit more about it in a minute, but interpersonal skills are going to be huge at all levels, but you have to practice them at the early careerist level. And then when I talk about networking, when you're an early careerist, you're networking within your organization. So in your department, networking is absolutely important because the people you work with become a second family. But also people in other departments. You want to get to know them. You want to learn from them because they're going to be instrumental in helping you to get a promotion later on. As you move into what I call mid-level management, now you definitely have a downline. You may have multiple layers. You might be 2 layers above the frontline employees. Some more skills begin to come in. And once you move from one level to the other, it doesn't mean the skills are left behind. So all the things we've already built on top of that, now you're going to work on your communication skills. Because when you're not directly talking to the people that work with you or for you in this case, information has to be delivered in a way that's going to be meaningful and is going to make it all the way down without poorly translation, all the way down to the bottom. This becomes a time when you work on your management toolkit. And I'll just say, managers make things happen. Leaders motivate other people to accomplish goals and make things happen. But at the mid-level, you do a lot of management. You may actually be doing some of the work hands-on yourself. This is also where continuing education becomes really important. So when you finish your degree and you get into the workforce, if you say, wow, I'm done, I never have to learn anything else, that's a problem. If you want to progress, that's a problem. So continuing education, whether it's through a professional services organization like ACHE or HFMA, whatever those opportunities are going to be really important. In my classes, issues and trends, one of the main assignments is to do a current events review of the literature, 3-4 times during the course of the semester. That habit is going to be instrumental in helping you stay current and helping you be relevant within your organization. And now you begin to do job specific networking. So I'm the supervisor, manager of medical records at XYZ hospital. I need to be networking with other medical records managers in other hospitals so that I can learn more and do more job specific education, but also staying current with current best practices. And then at the next level, Katie, is when you become at the executive level, here's where things really get to be more art and less science. And Yara did also mention this to some extent. So leadership versus management, I'm going to start with that leadership philosophy, that core philosophy. And again, Dr. Ossie already mentioned this, but I think it's critical. So quick story is I was asked to do a commencement address many years ago, and I could not personally remember any commencement address or the speaker at any of my graduations. So I knew that it wasn't going to be something that was going to be important just because I was the person doing it. And what I did is I said, what is it that I think I have been able to leverage over the years that allowed me to be successful? Because I'm not that smart, I'm not tall, I'm not all those, charismatic things that you look for in successful people, but I was very fortunate over the years to be able to be successful. And I codified a leadership philosophy, which was my philosophy, and it was very simple. In my world, effective leaders have to be principle-centered, relationship-oriented, and outcome-driven. It's PRO. I called it pro leadership. I did a speech about that. Then I wrote, a small pamphlet about it. And then over the course of time, I distributed that pamphlet to literally hundreds, maybe 1,000 managers who worked for me in different organizations over time. But this was my way of saying, this is who I am, and you deserve to know who I am if you're going to be held accountable within the organization that I'm looking to create. The other thing is, I think we all need to be able to articulate value. What is value? So if our job is to create value, to enhance value, what does that mean? There is I won't call it a standard because I don't know how many people use it, but I came across a mathematical equation years ago that I have adopted and I teach. And that is simply that value is equal to quality plus service divided by cost. And if you can put that in your mind so that you can use that in all areas of your life, especially when it comes to an interview for a job, that's going to be very helpful. But that becomes almost a set of guardrails that keep you focused on what's important. As a leader now, you have to be more worried about the organizational attitude, the culture of the organization. No one else is responsible for that except the senior executives. The board will set the policy, but the implementation and the actual structure and movement of culture becomes a responsibility of the senior executive. There are thousands of things that come into how do you move culture. And we don't have enough time to go into that today, but that's going to be a critical skill set. It's also important that you be that shining light that you want other people to aspire to, which means you have to be a role model. You have to have that strong work ethic. You cannot walk past a piece of trash in the parking lot and then hold someone else accountable for keeping the place clean. You cannot walk down the hall with your face in your phone and not address people, your family, your work family, your staff, look them in the eye and make sure they know that they're important to you. When I talk about enhanced communication and motivation, again, principle-centered, relationship-oriented, outcome-driven, you have to have core principles, I believe, to be successful, and you instill those in the organization. But you recognize that as the leader, you're like the conductor of the orchestra. The conductor does not play an instrument, does not make a sound, does not contribute in any way to the beauty of the music, other than by bringing other people together that have wonderful skills that can make the ensemble. That's your role. You are using your relationship skills to motivate others and to bring people together around a shared purpose to move the organization in the way that you want to go. Those are very important skill sets. I just want to mention strategy and innovation because Dr. Ossie really did a good job touching on this. But you think about the current pandemic. When I was in the military, one of my jobs was to be the disaster coordinator, for lack of a better word, for the Naval Hospital where I worked at the time. But as I moved through my career, I did FEMA training to be the incident commander for a large healthcare system. All of that is not about what you do the day you have the problem. All of that is about how you prepare for to implement a system that can address the issues and the needs of any particular issue that comes up. It's the same with business strategy, business intelligence. You plan strategies for the organization that can address multiple factors, and you do that by saying, what if this physician group got bought by our competition? What if this particular hospital were to be sold to someone else? What if we lost this? So strategy and innovation. And then again, Dr. Ossie already mentioned this, but board and community relations are critical. So I'll just mention quickly that at this level, now you're doing industry networking. You're a senior executive, but you are looking for best practice throughout the entire industry. You're going to national meetings, you're meeting with people who have written and done research and worked on task forces, and you're gathering. You're not expecting that you have the information or that you've hired people that have all the information. You're hungry for what the best practices are, and you do that. So early careers network within their hospital or their medical office building or their long-term care center. Mid-careerist network outside of that with other people who do the jobs that they do. Senior executives network within the entire industry. And then lastly, there are credentials that are important. It's not necessary that you become a fellow in the American College for Health Executives or that you have an HMI credential, but I can promise you that the things that you learn with that credentialing are important, but mostly they force you to continue in education. You can't keep the credential if you don't stay current and don't take the courses that you need to be on the leading edge of best practice in the industry. So with that, I just have a couple of quick things I want to plug for the program, and I want to make sure we have time for questions. But this program, UCF, is on the top 10 list for what the healthcare management people say is bang for the buck. And these are quotes that come right from their report. So, and I thought it was interesting that they emphasize issues and current trends in healthcare. Well, I mean, that's where it is. That's who we are. That's what we do. But here's what's important to you. Almost 90% of our students found employment in the field within 3 months. And that is a statistic that is really, really, really good within the industry. And then Katie, go ahead and go to my last slide. This is just one of the quotes that I like, but this kind of sums up where we are today. So we could be sitting here saying, I can't believe that we lost all this money because of the pandemic, or I can't believe that we can't do this because of the pandemic. Or we could be sitting around saying, well, you know, there's nothing we can do. We just have to wait till it's over, right? Or we can say, given the certain circumstances that we're in, given our strategic plans for the organization, this is going on. How do we manage within this set of circumstances to be the most successful we can possibly be? We're going to set the sails, adjust the sails, and we're going to keep the organization moving forward no matter what. And with that, I'll just say thank you again, Katie, for letting me be part of this. And we'll see what questions may have come through or what questions Katie may have for us.
Thank you so much, you guys. We do have a couple of questions here. Let me just pull them forward. Okay, so the first one is for Yara. You had mentioned earlier about some of the research you're going to be doing overseas. Can you dive a little deeper into some of the questions that you're going to use and get answered? Yara?
Yeah.
Sorry, you were muted.
Sure. I deserve it after not being in on video. Yeah, so I was fortunate enough to receive a Fulbright for what was supposed to be this coming academic year, but seeing as it's an award for international travel, it's being postponed, fortunately, so that I can do it eventually. But when I can do it, the purpose of my project, so I will be going to the West Bank and the Palestinian territories to assess how movement restrictions of all kinds affect healthcare. And I'll be doing this in a 3-step process, which includes focus groups with patients, physicians, medical students, stakeholders at all levels, interviews, and then ultimately I'll develop a survey. This is over 2 years. So when I first submitted the project, obviously I had in September of last year, I had no idea how relevant to the world movement restrictions would be on healthcare. At the time, you know, COVID was not a thing we were talking about or considering. So what I'm really interested in now is seeing how generalizable what I get from my research is outside of the fragile environment. And now we have to consider these kinds of things all over the world, no matter what state of development a country's in or anything like that. We have to consider how, you know, people in rural populations, even within the U.S., can't access certain forms of healthcare. So that's really my interest. How can we better improve healthcare outcomes? How can we meet the needs for medical education in situations where people are not able to move freely for whatever reason?
Thank you. And one more question for you. What do you find is the most common misconception that people or students have when they're entering into the health administration or health services administration programs? What are the most common misconceptions?
I would say I'm going to have to cheat and say there's 2. The first I touched on a bit, which is that I will work in a hospital and I will retire in a hospital. And most students eventually in their careers, that is not the case. And I think at the beginning that frightens students because they don't know the industry very well. And what they associate with healthcare is that big, huge hospital where all the doctors work. But I think after they're in the program and they learn a little bit about healthcare and maybe they do their internship, which is of course a part of the program that hopefully our audience knows about, and they learn more, it opens up instead of closes the potential within the industry. Because now if you're kind of interested in psychology, but you have this degree, well, you can work at a mental health facility. Or if you're really interested in politics and policy, well, you can go to DC and work for HHS, or you can work for, a lobbying organization, the American Cancer Society. There's so much potential. So I think once students accept that the hospital is not the end and is just maybe the beginning of your career, that really opens a lot of doors. And then I would say the second, which I hope Shannon will touch on, is that, I can be this high-level position, the CEO, the VP, 5 years after graduation. And I think one thing that Shannon's presentation really showed is, it's really less a career ladder. And I hate to overuse this cliche, but it's really more of a career lattice, right? You may make some lateral moves into different parts of the industry. You move up a little here. Maybe you get a management position here. You don't know what you like 5 years into any career. You are still learning at that point. So I think if students can just be open-minded, accept opportunities, look around, see what interests them outside of just the title. Because obviously there's a lure to having a high title position, but ultimately, if you're going to be doing a job for decades, you want it to be something that you're good at and you're passionate about. So I think, again, when students kind of dispel that assumption that I will just move right up on through the ranks and it'll be a smooth transition and that's it, then that allows them to kind of look around and maybe take a job for slightly lower pay in an industry that they really want just to get in the door, or move out of Central Florida if that's what they need to do, or even to another country. So I think students come in with a really narrow view of what healthcare administration is. And then what I hope I and the other faculty and the curriculum do is really open their eyes to how big the industry is. It's not just about that top level at a big hospital. There's so much more granular and local change that can be done. And a lot of our students are doing that.
Yeah,
Thank you, Yara.
Katie, I'll just mention on top of that, no one in their right mind would paint a career path like the one I had. I came out of the military into medical records. I knew nothing about medical records, but they hired me to manage the records process, not the technical side, but the mechanical side. How do you find the records? How do you file the records? Where do you get them? And after a year of that, the assistant vice president for ambulatory came to me and said, how would you like to run the ER? I didn't know anything about the ER. After that, how would you like to be the business manager? If at any one of those points in time I had said, gosh, I don't know how to do that job, I'm afraid to say yes, who knows where I would have ended up, but I would just said, sure. And that goes back to that job competence thing. So you get into the industry, it's like a river, eddies and flow, and you got to go with the flow, and you just work hard every day. Good things will happen and you'll end up where you end up. I know that sounds flip, but that's the way it works.
I totally agree. Couldn't agree more.
All right. Oh, we got one more question. This one's for you, Shannon. What are some of the common mistakes you've seen healthcare leaders make in regards to those types of management positions, facility management, business management, with the progression that you and Yara both spoke about? Like, what are some common mistakes that they're making at those mid and upper levels?
Well, you don't have a career like mine without being able to articulate a long list of missed opportunities. So I teach my students and I preached for many, many years the concept of, the golden circle of people don't buy what you do, they buy why you do it, but also the fact that, all decisions are made not in the logical brain or the neocortex, but in the primitive brain. So we have to think, act, and communicate in language that speaks to the primitive brain, which is opportunities and dreams and possibilities. So let's talk about what are some of the opportunities for people not to make the kinds of mistakes that some people make. One critical mistake is this thought of I'm the leader now, so people have to do what I tell them to do. The concepts of I manage because I'm your mother, wait till your father comes home, or you can't if you don't eat your meat, you can't have any vegetables. Those types of coercive leadership management strategies are non-functional. So new leaders who get self-absorbed and self-important in their position are the ones who usually fail the quickest. So servant leadership, and as Jim Collins would say, a very healthy dose of humility as you're going through any leadership position are going to be absolutely critical to your continued success. I think the other thing that people struggle with, I did early in my career, but not for very long, is this concept that I have to be viewed by everyone as being, the top of the heap. People have to think I'm the smartest. People have to think I know what I'm doing. I have to project an image that says, you can trust me. And what happens is, we're working so hard to convince people that we're job competent and confident that we miss the opportunity to stop and say, hey, I need to know more about what you do. Could you please help me understand that? And to be willing to say, I don't know. I don't have the answer to that, but I want to work with you to find the answer. I think especially when it comes to board relations, CEOs are mortified of being asked a question that they can't just answer in the board meeting. And that's something that people just absolutely have to get over. And then maybe one more thing that I think is critical is we talked about principle-centered, relationship-oriented, outcome-driven. What in my world, the principles define the culture defines the operation. In the world that we live in, all of those things are cumulative. So principles drive culture, relationships drive outcomes. But I think the other thing is this concept that, good things happen to good people, bad things happen to bad people, that things happen. The world around us happens, and we don't control those things. As a leader, I think it's critical that we understand that we don't have control over much, but we absolutely have control over our attitude and the way we react to things. So this is true in my life, and I think it would be for others. Bottom line is, if I think it enough, I believe it. If I believe it, it becomes part of my body and my language. And as I talk about it and act on it, those actions will tend to produce results, and those results will produce outcomes. And so if you back that all the way back, DeWitt Jones and his wonderful work with National Geographic learned that if he believed it, he could find a picture, not the other way around. I think that fundamental stake in the ground for how you're going to lead and the culture of the organization and how you're going to motivate others, it all starts with yourself. And I think those are basic things that we don't teach in school, and people have to learn on their own, or they have to come through one of my classes and listen to a very long, boring lecture.
Thank you, Shannon. But we always love when you talk, because your experience can't be learned in the classroom. So being able to share that with the other students is great. So that concludes our Q&A and the general information. I want to thank our panelists, Dr. Yara Ossie and Shannon Elswick. You guys are excellent. What a great way to dive deeper into the health administration from beginning all the way through executive level. Here's our general contact information to reach out to myself, or even get the information from our faculty members to find out more about what they're doing in health administration, our programs, etc. We also have more webinars. This was our session for today, but we also have an evening session this evening around 5:30. It is a really cool session talking about the bridge between administrators and clinicians. So be sure to check out our website, get registered for that session, and join us with some MDs, some social workers, and health administrators to discuss that. So thank you again to the panelists, and thank you everyone who's watching.
Thank you so much, everyone.
Thank you. Bye-bye. Good luck, everyone.
Bye-bye.